All right, hello, good morning. Good morning. It's been a long time. I've been taking a little break, trying to take care of life. All right, but the good news is I am back. Now, recently I had a question on sickle cell disease, and I wanted to leave you guys a short video explaining sickle cell disease. All right, let's go. So, sickle cell disease has a hereditary component to it. It's a hereditary blood disorder affecting hemoglobin structure and function. Let me show you guys what I mean. So when you look at this drawing, all right, so you look at this is normal red blood cell. It's round in shape, all right? So this is what it should look like. On the other hand, if you look at sickle cell red blood cell, all right, it is sickled. It is crescent shaped, all right? It's not as round. So structurally, this is what I want you to take away. Normal red blood cell, round in shape, sickled red blood cells, not round in shape. Later down the slide, I am going to show you how this is going to impact blood supply to the tissues. All right? So, again, sickle cell disease is a genetic disorder where the blood cells become crescent shaped. They're not round as they should be. The consequence of this is that blood flow is reduced and oxygen delivery to the tissues is impeded. We don't want that to happen. But that's what happens in sickle cell disease. In terms of the cause and the genetics, you have to have a mutation in the beta globin gene. And when this happens, you have amino acid called valine being replaced by glutamic acid. All right? Now I want to take you back to undergrad. Remember undergrad biology 101, we learned about inheritance pattern. You remember autosomal recessive, autosomal dominant. In terms of sickle cell disease, the inheritance pattern is autosomal recessive. What this basically means is that you need two abnormal genes to have sickle cell. You get one abnormal gene from the father, you get another abnormal gene from the mother. That's how you have SS. And that's how you have sickle cell disease. If you are a carrier, you only have one abnormal gene and one gene that is normal. So you don't at that point have sickle cell disease, but you are a carrier. You are asymptomatic. And what that means is that you are capable of giving someone the abnormal S, the abnormal gene. Okay? That's what I want you to take away from this slide. Pathophysiologically, you would have deoxygenation of blood. Again, if the red blood cell is sickled, it's not round as it should be. Blood flow is impeded. There will be deoxygenation of blood to the tissues. The hemoglobin S will polymerize. You have sickle cell. And because you have these cells that are crescent shaped, the blood flow in the small vessels will be blocked. And this can lead to reduced oxygen supply, which we call ischemia. You can have things like hemolysis, and you can have anemia. Now, clinically, what should you look out for? I want you to pay attention to when a patient is saying, I'm fatigued. You look at their skin, they have discoloration, yellowing of the skin, which we call pallor. Okay? These are important features of chronic anemia. You also notice that these patients tend to go through pen crisis. Okay? This is one of the most common causes of their frequent visit to the emergency hospital. They can have dactylitis, which is swelling of the hand and foot. They are predisposed to encapsulated bacterial infection like strep pneumonia, Klebsiella, Salmonella, even E. coli. They can have stroke, leg ulcers, even priapism, which is prolonged erection. They can also have splenic sequestration, where red blood cells are basically trapped. It can lead to swelling, and it can be very painful. All right? Complications. You can have aplastic crisis, in which there's a depletion in the production of red blood cells, white blood cells, as well as your platelets. And this could be because of parvovirus B19. They can even have acute chest syndrome. Guys, I want to tell you now, when I was taking my board exam, I had a question like this. So the patient had sickle cell, but they were presenting with acute chest syndrome. If you are not careful, they are going to trick you, and you might start going the route of cardiac problem. In reality, this is sickle cell displaying a complication of acute chest syndrome. These patients can have renal failure, retinopathy. You could also see delayed growth and puberty. So I want you to keep an eye on this potential complications of sickle cell disease. In terms of diagnosis, it is imperative that we are able to identify and screen newborn babies. You can use hemoglobin electrophoresis. When you do peripheral smear, you are likely to see these cells being sickled. That's what you're likely to see. Of course, you want to get your basic labs, right? And you are likely to see low hemoglobin, high reticulocytes, which is an indication, could be an indication of hemolysis. And you can see increase in bilirubin. In terms of management, you can acutely manage these patients. How do you do that? You make sure that you take care of the pain. All right? Give them pain medication that will address the pain crisis that they're going through. IV fluids if they're dehydrated. Oxygen if they need it. You want to treat the infection. Like I mentioned in the past, they are predisposed to encapsulated bacterial infection. They may get to a point where you have to do transfusion, depending on the severity. Chronically, you want to use hydroxyurea. Okay, that has been shown to be very helpful in terms of the management. You're going to likely give folic acid. It's important that they get vaccinated. All right, and we just keep an eye on them. Curatively, bone marrow transplant has also been shown to be effective. All right. In terms of prevention, again, it is imperative that you go through genetic counseling and premarital screening. For those of you who are excited, you found the love of your life, you can't wait to get married. That's so beautiful. But I want you to also ask questions. You know what I always preach on this channel? You cannot cure what you don't know. The more information you know, the more you are better positioned to address the problem. It's very simple. All right. So I want you to get in the habit of screening and asking questions of your potential partner. All right. So that you know what you're getting into. It is important that we screen newborn babies, and that will likely lead to early intervention. I'm also a big advocate of educating patients regarding triggers. All right? Because if you can identify the things that trigger the crisis that you go through, you are better able to manage the condition that you have. It is important to watch out for dehydration. That's why when these people go to the hospital, you manage their pain, you give them IV fluid. All right, if you're dehydrated, it's likely going to exacerbate your pain crisis. So stay hydrated. All right, extreme cold temperature can also be a trigger. Infection, as I mentioned in the previous slide, can also be a trigger. So keep an eye on those things. All right. So very short, quick, nice, simple video that I wanted to drop for you guys and to let you know that I've been busy, of course, dealing with life outside of YouTube channel. All right. So I want you to leave your comment in the section if you have any medical topic that you want me to address. Just put it in the comment section. All right. Share the video, like, subscribe, and stay healthy. All right. Again, this is Patrick. Thank you so much. Bye.